hygiene seems so simple. You wash your hands for 20 seconds, you sing the happy birthday song twice, but do you know that the CMS surveyors or your state surveyors are actually looking for more than just how you're washing your hands, but when you're washing your hands? Hi guys, I'm Dr. Buffy. And I often see facilities struggling or doing poorly with their hand hygiene related to their CMS or state survey. We want to make sure that everyone in your facility is compliant with hand hygiene, not just to pass your state survey, but for protecting your vulnerable patients and your healthcare workers. We want to make sure that everyone is conducting hand hygiene appropriately for the appropriate time, including those clinicians. Are you aware that alcohol-based hand rub is the preferred method for hand sanitizing within your facility? This is according to the Centers for Disease Control and Prevention, and many facilities don't realize that. They think washing with soap and water is the preferred method. But check your CMS survey and you'll see on there that it actually asks that you have it within your policy that ABHR or alcohol-based hand rub is the preferred method. Now keep in mind, this is for most situations, and obviously if the hands are soiled or there's certain infectious diseases that they're using soap and water in those clinical cases. One of the missed opportunities that I often see are conducting hand hygiene before donning the gloves. So you always want to make sure that you're doing hand hygiene. You can use the alcohol-based hand rub before donning your gloves or putting them on, as well as after doffing or taking them off. One of the first things that I look for when I go into any facility is I note how many hand sanitizer dispensers are outside of every resident room. If I only see one or two or none, I know that hand hygiene is not happening. We want to make sure that hand hygiene is occurring before resident contact, after resident contact, after contact with the environment, before and after donning and doffing gloves. These are the times when every single time hand hygiene needs to be conducted. And if you don't have appropriate supplies available to your staff, guess what? It's not happening. Many facilities will say, we have hand sanitizer dispensers inside of every resident room, and that's really good. However, according to the CDC, you want to have them inside and outside of every resident room. And if I had to choose, I would encourage you to have them outside of every room, because people like me coming into your facility or other clinicians, as they're walking by a room, they have access to that hand sanitizer and they can use it. I don't feel comfortable walking into a resident room to conduct hand hygiene, and so this makes it available. We want to take the human element out of hand hygiene. We want to hardwire this practice. So every single time your staff or anybody coming into your facility, anytime they see one of those hand sanitizer dispensers, they put their hand under it and they use it. And this is going to increase compliance so much. I see it happen all the time where you have low compliance, maybe 30–40%, and then you install the hand sanitizers outside of every room and compliance jumps up to 70–80–90%, simply just because you've made it accessible for your staff. Don't forget about your residents. This is very important to making sure that they conduct hand hygiene before their meals, after using the restroom, and it is on the CMS survey, the state survey, asking how the residents are conducting hand hygiene. So for example, if it's hard to get the resident over to the sink, or the hand sanitizer dispenser's high, consider bringing in a bottle of hand sanitizer and just squirting a few pumps into their hand, and then they can do the appropriate hand washing. So this is one way that your residents are able to be in compliance as well. In our next video, we are going to have some fun with personal protective equipment. It's going to be hands-on and interactive, and you definitely don't want to miss it. So I'll see you over there. And I often, why am I struggling? It's so close. Okay, I know you're gonna put that on the bloopers right there.